Let's see, go down one so that you can see the whole thing. No. Alright, so this paper that we're going to be reading is on COVID infection in the second trimester of pregnancy, and this is specifically a case report of fetal intraventricular hemorrhage after critical COVID infection, and a brief review, stealing paper, brief review of the literature. So they're probably doing a deep case study where they're going to be doing a necropsy on the fetal cadaver, and we're probably going to get a lot of detail on that one case. These are good because they give us sort of a deeper insight into things, and they're also going to compare this back to the literature. So that's essentially the essence of what this paper is. And then let me just scroll, make sure there's no questions yet. I think we're good. Cool. All right, so this is the abstract. So more than 3.5 years have passed since the start of COVID. Blah, 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 civil studies. In this report, we present a case of a 36-year-old patient with a history of 2 cesarean sections. So this is a mother who's had 2 previous babies that had complications because they had to do the C-section. There were 2 miscarriages, so that's very unfortunate. So hopefully the 2 C-sections were not 2 miscarriages. That would be very sad. The 36-year-old mother has hypothyroidism, is on replacement therapy. They contracted COVID during the 15th week of gestation, so we're going to highlight that. That's important. That should be yellow. And then we have ultrasound examination at 22 weeks, revealed regular fetal biometry, I don't know. Just the biologic parameters, and bilateral ventriculomegaly. I'm gonna have to Google what that one is. Ventriculomegaly. Ventriculomegaly. I know it's probably to do with the heart, the ventricles, but megaly is the... So it's a condition in which the ventricles appear larger than normal on a prenatal ultrasound. So, okay, interesting. Gonna highlight that. And then that's suggestive of a massive intracerebral hemorrhage. Oh, that's interesting. So it's not the ventricles of the heart, it's the... I'm gonna make that red because that's a scary thing. So looking back, so it's not the ventricles of the heart, it's ventricles in the brain. So right here, let's see, zoom in. Oh, well, the picture didn't change, so I'm gonna have to scroll the phone. So it's specifically talking about these right here on the ultrasound. These are enlarged, so that's a normal brain. And then this is a brain with ventriculomegaly, which is increased size of these ventricles with fluid buildup inside of them. So that's what we're looking at. Oop, my computer is in the way. So that's what that means. And this is sort of what you do when you're reading the research papers, is that when you see something, you're like, I'm not sure what that means. Literally just look it up. Hello, hi Romy. So that's the thing that they noticed. The patient opted for the interruption of pregnancy, so they opted for either an early birth or a miscarriage. Let's figure out what that is. Given the critical maternal COVID complications, especially tracheoesophageal fistula and the patient's 2 previous cesareans, we decided on an abortive C-section at 23 weeks. Okay, so the mother had these... Is she okay? Oh. My partner, I think, is cutting the dog's toenails. She just yelped, the dog. So because of the mother having to be trached during the COVID infection, and because of the history of 2 C-sections, they decided to abort at 23 weeks, and then they sent the samples to the pathology department. So, yep. And then they did a histological analysis, which showed massive intravillous deposition of fibrin inflammatory inflammation with hotspots of necrotic deciduitis, and confirmed massive cerebral hemorrhage in the fetus. So the fetus had brain damage, severe brain damage. There's severe intracranial swelling, and then something died, some cells died. That's what necrotic means. So I don't know what deciduitis is, so I'm going to look that up. Google deciduitis. It's a slight inflammation of the decidua found during pregnancy. So now I have to look up what a decidua is. Decidua. It's a thick layer of modified mucous membrane which lines the uterus during pregnancy, and it's shed with the afterbirth. So the membrane that surrounds the uterus, there were cells that had died in there, which indicates that there's not adequate blood flow to it. This is so sad. Wow. Yeah. And this is all a result of the COVID infection. So that's pretty wild. So this dead uterine tissue, basically the brain, for whatever, or the fetus was not getting enough nutrients through the placenta, and this somehow resulted in the brain swelling, massive intracerebral hemorrhage, and then there's deposition of fibrin. So if this is, what's the word? This could be actually the deposition of fibrin, so that could indicate that COVID entered through the placenta into the fetus, and then this would be the fibrous microclotting, potentially. We still have to get there. We're still only in the abstract. This could be the an indication of vertical transmission from the mother to the fetus because of that intravillous deposition of fibrin. We just have to see what type of fibrin it is. Yep, so right here, what I was just telling you. So this morphological appearance was consistent with COVID-19 infection, so it sounds like this is a vertical transmission to the fetus, and then there's probable fetal oxygenation compromise related to the cell death that was in the uterine membrane. So yeah, as a reminder, like when I'm reading these papers, I don't know everything. I don't know all the different words. Like this is specific to fetal pathology. I don't know a lot about this stuff for fetal medicine. So like when I have to look up words, it's literally, don't feel bad if you have to look up words. It's all a part of the research experience. And I'm just gonna save this in my thing so that I don't lose my work if anything happens. Save. Let me just double check. Haven't missed any comments. Nope, we're good. Okay, so that's what we've learned so far. And then the immunoexpression of anti-COVID antibody was almost entirely positive at the level of syncytiotropoblast, syncytiotropoblast cells and maternal leukocytes in the absence of a clear signal in the fetal circulation. Okay, so the mother is definitely producing COVID antibodies. The fetus might not be. I don't really know what they're meaning by that at this point. I can make you coffee. One moment, I'll be right back. I'm gonna make coffee, or start coffee for my partner. ones. Was Sheila on that screen?
Yeah, she was on the screen.
Okay. Alright, I'm back. Alright. So we're going to learn later what that means. So if the fetus just doesn't have enough immune system to appropriately generate this response of the antibodies to COVID, if the antibodies produced by the mother aren't able to transport to the fetus because of the compromised uterine lining, the necrotic cell death in the uterus. We're going to learn that later in the paper. Let me just double check that I haven't missed any comments. Nope, we're good. Okay, so that's what we've learned so far. And then conversely in the brain, immunoexpression of the ACE2 receptor and the angiotensin converting enzyme ACE2 and the S1 subunit of the spike protein of COVID was detected by a monoclonal antibody, was almost entirely negative, suggesting there was no infection in the brain, and that the mesh of intraventricular hemorrhage was probably a secondary effect of placental damage. Okay, cool. So this is telling us that there was no COVID that was detectable in the brain. So they're looking for the spike protein, the S1 subunit of the spike protein, and they were detecting it by a monoclonal antibody. And it was almost entirely negative. That means, okay, so that's a very important part of the sentence there. So that means it was present. There was COVID spike proteins present in the brain, but not enough to make them think it was an infection in the brain. It's a weird way. We're gonna have to see what happens later in the methodology and results section. But what their conclusion is that there is no infection in the brain, and that the placental damage from COVID is what is causing this brain damage to the fetus. I'll make that red. It's important. Safe. Okay. Moving on to the introduction. Take a quick sip of water. So COVID has had a huge impact on the scientific community, prompting scientists and researchers to undertake massive efforts to comprehend what's going on, blah, 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 telling us about the history of it. There's varied organ involvement, such as the skin, the gastroenteric system, and even the encephalon. That's a unique word. Let's look it up. Encephalon. The brain. Okay, I've never heard the brain called that before. Encephalon. Although the underlying mechanism has not been fully elucidated, so we don't understand it yet, several studies have suggested that the placenta acts as a barrier, capable of stemming the spread of virions and preventing potential fetal transmission to the fetus, fetal transmission. And they've already reported in a previous paper a case of twin pregnancies where severe alterations in the placenta discs were described, but without transmission to the fetus. So it seems like there's not necessarily always going to be vertical transmission from the mother to the fetus when they get a COVID infection. However, it seems to be pretty common. There's this thing called SARS-CoV-2 placentitis, which can be a complication with a COVID infection in the second and third trimesters, where it can actually damage the placenta in certain ways, which can deprive the fetus of oxygen and nutrients and cause issues such as this brain swelling, this brain damage. And then this also results in like seizures and things like that. They've been seeing an increase of those that we covered in other papers, or I've covered in other papers that you can look through. Let me just double check, no comments. Thank you for the likes. So that's what we know. And then so in this report, we do the fetal ultrasound. I'm really interested in the histopathology. That's going to be interesting. So this was during the second wave of the pandemic, during the alpha variant phase when that was dominant. So for me, my color coding system is yellow is just interesting facts. Green is really cool facts. Usually that has a good connotation or things that I want to follow up with. Red is very cool facts that are bad. Like above, there's lots of red, like you don't want this hemorrhaging onto your brain, and you don't want cell death for your placentas and stuff like that. So we're giving the case presentation. So this is usually like high level. It starts off, it's patient, the patient's age, the patient's sex, usually the patient's race, etc., the history. So this is only going through the specific history, it looks like. So it's doing a 36-year-old patient with a history of 2 C-sections, 2 miscarriages. That sounds like we're related to those 2 C-sections. And then hypothyroidism and therapy for the hypothyroidism. And then they contracted COVID during the 15th week of gestation. First trimester combined screening showed a low risk for chromosomopathies, that's a fun word, chromosomopathies, with regular fetal morphology and nuchal translucency in the normal range. Nuchal translucency. This paper is teaching me a lot of new words. Nuchal translucency. So nuchal translucency is a scan that measures your baby's nuchal translucency. Okay, that was a dumb sentence, but it's basically a fluid-filled space behind your baby's neck. Okay, so I don't know what NB is, but nuchal translucency is basically this fluid space behind the brain. It looks like it's just above the spinal cord. The spinal cord, that's the esophagus, so the spinal cord would be like right here. So it's just below the spinal cord. Interesting. It was in the normal range, so they didn't have issues. The patient had interacted with COVID positive person at 14 weeks and 1 day of pregnancy, and afterwards started showing symptoms such as fever, chills, lower limb weakness, and thoracic oppression. I'm assuming that means hard to breathe. So we'll highlight that. I'm missing some comments here. Do you put these lives on YouTube? I don't, but I can if people are interested in them. That might be useful. I could probably make a new section for that. So that's a good idea. I can probably download these lives and upload them as like examples of walking through. And then I wonder if the age of gestation made a difference. Also, I think it does. The age of gestation, they're not like there's a paucity of literature. There's not enough literature on first trimester. There's a little bit that's showing that second trimester issues are, or second trimester infections can result in this SARS-CoV-2 placentitis, and then third trimester infections can result in seizures and things like that. So it seems like that's the danger window. I haven't seen any correlations yet with first trimester infections and fetal outcomes, but that doesn't necessarily mean that there is no issue with it. So that's sort of, I do think it does make a difference, but I'm not sure what the difference is yet. I'm still learning. What's your guess on how COVID will behave for years to come? That's a big question. That's ultimately dictated by policy and behavior. I think that if we continue on this unchecked road, a very large segment of our population will get disabled, and that we're going to have to do our entire society at a global scale to compensate for this mass disability. Yeah, I don't think it's a good thing. It's a good question, but I'm not. It's hard to predict, but ultimately that could be like the long term, but like there's also like short term issues like with the immune suppression that we know that happens and that we've been yelling about, or at least I've been yelling about since I learned about it, which wasn't too long ago, which was like 6 months. But like we're already starting to possibly see that with this quote unquote white lung pneumonia, whatever it's called. It's just literally just pneumonia. It's walking pneumonia that's happening from a combination of different viruses and bacteria, and it's likely because of the COVID immune suppression. And then nasal bridge. Yeah, nasal bridge probably MB, or nasal bone, I'm not sure. She did have a lot of previous history problems. Yeah, she did have a lot of previous history problems, but the interesting thing is that so far what we've learned from her history is that the fetus was developing completely fine. It didn't have any issues until the COVID infection from all their follow-ups. Yeah, and that's the thing. We go through and we Google the terms we're not familiar with so that we can put it into context and understand how we're doing it. I think the rate of first trimester miscarriage is the highest without COVID. Hard to tell. Is highest without COVID. I'm not sure. I haven't seen anything on first trimester infections, so not sure. Okay, going back. So after 24 hours, 1 day of hypoxemic status, the rapid deterioration of her clinical conditions led to step-up hospitalization in the ICU. The patient underwent non-invasive ventilation and quickly proceeded to orotracheal intubation. So that's the tracheotomy that they talked about earlier. During the hospitalization, the patient was administered Clexane, some sort of drug, as prophylaxis for deep vein thrombosis. Okay, that's not good. So the patient was getting deep vein thrombosis together with cortisone and an antibiotic. Okay, so they were treating with... Why were they giving her an antibiotic for a virus? That's weird. Maybe they were just trying something, or maybe because of the tracheotomy, they didn't want to risk an infection. Yeah, it's even saying here, the patient didn't have any bacterial infection, so I don't know why they're giving the patient antibiotics other than open wound from the tracheotomy. So after a few days, she underwent a percutaneous tracheostomy. Okay, so we're moving from a tracheotomy to a tracheostomy. So let me just double check the difference between them, just so I can share with you, because they're fun. There are two different things. Tracheotomy versus tracheostomy. So a tracheotomy is for an incision into the trachea, the windpipe, right here. And a tracheostomy the temporary or permanent opening itself is called a tracheostomy. However, the terms are sometimes used interchangeably. I thought they were different. What's the difference? Oh, so the tracheotomy refers to the incision in the cut that the surgeon creates. The tracheostomy refers to the opening itself. Cool. She went that. Coagulation tests were within normal range, except for an elevation in D-dimer. 2 days later, at 18 weeks, 3 days pregnancy, and after 15 days of intubation, the patient woke up. That's good. That's showing progress and healing. So it's important to note that the mother is on support that's getting several medications. So it's possible that some of these medications might be contributing to the issues. But this deep vein thrombosis is definitely a complication of the COVID, or most likely that due to the, what is it called? The clotting changes that happen from a COVID infection. So the patient woke up and 4 days later, test returns negative. Okay, so she woke up. So basically she was infected for 19 days. Do a quick control save and see the friend was placed in a vaxxed ward because the unvaxxed ward had more delivery complications. Yeah, I'd imagine that the unvaxxed ward would, unfortunately. And then experienced a tracheoesophageal fistula as a post-intubation complication and underwent a percutaneous endoscopic gastrotomy feeding. That stinks. Ugh, this mother is really put through it. So, let me show you what that is. Endoscopic gastrotomy. So if you've ever seen people with those little bags that are, what did I spell wrong? Oh, I think I just spliced two words together. Endoscopic gastrotomy. So, here we go. So they put a tube into your stomach so that you can get nutrients. And then, okay, so we got that. So the patient underwent So at 21 weeks, 5 days, so this was, they checked on the fetus after the mother was okay, so they were focusing on the mother as the patient. I'm not sure why they didn't do any monitoring of the fetus during this, but they didn't seem to. They don't seem to have. But after the mother woke up, a couple days later, they looked at the fetus and it's showing bilateral hydrocephaly with third ventricle dilation. So they're seeing that brain swelling. And then they have measurements of it, so significant brain swelling. And then they're also noting a massive hemorrhage, a pseudocyst. Ooh, figure 1A. So let's skip down to figure 1A. Okay, well, I'm not familiar with these types of things, but it's saying that right here and right here are the two issues. So the anterior proximal horn is associated with the blood clot. And the medial scan is showing the pseudocyst. Cool. Follow-up with the patient at 6 months after C-section showed a significant regression of long COVID. Oh, what? When did they say the patient got long COVID? Burying the lead here. Okay, well, they're not detailing what long COVID symptoms the patient had, but it looks like they got long COVID, and their symptoms reduce after 6 months from the time of the abortion of the fetus. So it was an appropriate weight. So now we're at the autopsy section. So it's appropriate weight for its time in pregnancy or time under gestation. There's a grade 4 hemorrhage, so that's pretty severe. There's evidence of ischemic damage, so that's just not enough oxygenation, and the damage is associated with the adrenal glands, heart, and encephalus, brain. The heart was normal shaped, even though it was ischemic. So it's not a developmental issue, I guess is what they're getting at. The diaphragm appeared normal. All the internal organs had a regular shape and location. So again, that's just saying that the fetus was developing normally. The placenta weighed 250 grams and measured 10 by 40 regular. 40 centimeters with a central insertion of the umbilical cord in line with the gestational age. So they're saying again, like the placenta is appropriate weight, it's appropriate size, it's connected correctly, so it's not some sort of connection issue. I don't really know what to call it. All right, here we go. So this is the meat of it. And then we'll get some pictures in 2A to 2C. So there's fibrin deposition, there's granulocyte infiltration. So the granulocytes are these small little, usually purple dots, depending on the staining, that we'll see in the histo slides, which just sort of show that there was an infection. And then there's localized cell death, and the placental lining that they already mentioned. So all this is in line with COVID infection and probable fetal oxygenation compromise, so not getting enough oxygen to the fetus because of the damage to the placenta. Cool. These are the pretty pictures. Let me just double check. Comments. My father had both a trach and endoscopic gastro post-lung transplant for 6 months. It's gnarly. Yeah, it's definitely gnarly. What, a publication that actually says long COVID? Yeah, a bunch of publications will say long COVID. Yeah, long COVID is what they go with. Originally, during like the first year, second year, they were going with PASC, P-A-S-C, post-sequela, secula, or seculae. I'm gonna Google that word. I've never known how to pronounce that. Sequela. Sequela. Give me that Google talk. Sequela. Okay, so I'll just show you. PASC is what they were originally calling long COVID. Post-acute sequela of COVID-19. And then in the long COVID community, a lot of them call it long haulers. But in general, people have adopted the terminology of long COVID in the scientific literature. Cool. So just reading the caption. So in A, this one right here, it's extensive intervillous fibrin deposition, terminal villus hyperplasia. parangiosis and maternal malperfusion. So I can at least show you the fibrin deposition. So see these like weird dark purple areas, like here and down in here? That's areas of fibrin deposition. These are the granulocytes that show like local systemic infection. Usually when you sample these areas, you can see if there's like a virus that's sort of located within it. So some comments in this lab were filtered to protect the community experience. Okay, I don't know what comments, I guess I didn't do that. So there's that. And this one is sort of the local swelling right here. And then some fibrin deposition again. These areas. So that's neat. Let's see, you can see stuff. Cool. And then they did immunostaining with anti-COVID glycoprotein monoclonal antibody on the placenta, see if there might have been transmission. This would be vertical transmission from the mother to the fetus. So this would be the question of, can your COVID infection be passed to your developing child? And the answer that we've seen in the literature is yes. But for this specific case, let's see. So immunostaining was strongly positive at the placental chorionic disc. So it's definitely in the placenta for this one. So that's directly what's causing it. I would suspect that this was a case of SARS-CoV-2 placentitis. On the other hand, immunoreaction was completely negative in the fetal brain tissue. So I'm going to make that green because that would be a good one, good thing. And they even performed this immunohistochemistry on the fetus's heart, lungs, and bowel, which all showed negative results, as well as doing blood sampling. So there was no vertical transmission in this case. All of the effects were located from the COVID infection in the placenta, and the placental damage, which resulted in a lack of oxygenation to the fetus, is what caused the brain damage. So this one is showing that the second trimester infection is damaging the placenta, impairing its ability to send nutrients and oxygen to the fetus, which results in developmental issues. But in this particular case, the fetus was not infected with COVID from the mother. So it's showing that, yes, the placenta in this case is doing its job. It's preventing infection from being passed on, but the damage to the placenta itself still resulted in issues in development. And they know that because the fetus was developing appropriately. It had all developmental appropriate signatures from the necropsy, but due to the direct effects of COVID, this is what happened. In this specific case, is what I should say. So now we look at the discussion. Save. So right now they're just recapping the study. Yeah, so in our case, switch back to yellow. It was like the brain damage was ultimately, or was probably related to obstruction of the ventricular outlets by the clot debris. So this, what's the word? It's the fibrous clotting that develops from COVID, since COVID's a vascular disease, which means it impacts your blood flow and your blood system dramatically and your ability to clot. And it causes giant sticky clots, fibrous microclots. It obstructed the ability of the blood to be able to flow appropriately to the placenta, to the fetus, and caused issues. So this is just saying the same thing that I just said. Oops. They did a wide screening for other issues like HIV, other viruses, to see if that could have caused the issue. It was all negative, so it's still providing evidence it's like ruling out, like, okay, were there these other confounding variables that we didn't consider, didn't know about, and they ruled those out. Christina says, I missed the beginning of this. Did they discuss how many weeks pregnant at time of infection? Yes, so this is a second trimester infection. It was 15 weeks, I believe. When was the infection? So they came in contact with the person at 14 weeks, 1 day. They developed it a couple days later. And then by 19 weeks into the pregnancy, they had cleared COVID. They were negative. Yep, no problem. Let's see. Yep, those are the things. So that's what we were looking at. So scrolling back down to the discussion. So what they were doing is they were just ruling out through like blood and urine tests where there's another infection that could have contributed to this, and they ruled it out and said no, all those things were negative. COVID is the only thing that could have caused this. The fetus developed normally. These other viruses we tested for were not present. Everything was on track until the infection, and then that's what caused these issues. So it's more like to help lead credence to a finding. Sometimes you have to rule out other things to make the argument stronger. And then they're pointing to some other cases where similar findings happened. So now they're at the point where they're saying, so now they said their findings, they tried to like verify their findings by ruling out other things, and now they're looking in the literature saying, how does our finding fit with what other people have with other cases that were presented on. Like right here, they're saying there's a case of vertical transmission during the second trimester, the 21st week. In this other study, or case study, there is hydrocephaly, like in this case here with the child, where there was that intraventricular hemorrhaging, so it's a similar case. When there was and this was after a case of severe maternal COVID infection, which would be similar to this case as well. So 25.5 in terms of the time in infection. So, wow, that was long, 5 weeks. This person had just over 2.5 weeks. But this other case they're referencing was about 5 weeks of infection. And right now they're describing SARS-CoV-2 placentitis. So I'm going to back up a second. So they're not specifically calling it out. What they're calling is the frequent histological patterns. So things that they're seeing a lot that's associated with these COVID-19 infected placentas, where they're seeing acute and chronic inflammation, fetal vascular malperfusion, not getting those nutrients, maternal vascular malperfusion, the mother's not getting enough, oxygenation, edema, swelling. And now they're noting different things that COVID infection cases compared to non-COVID cases. And they're looking at rates of impacts on the placenta, and they're seeing that there's this fibrin deposition, fetal vessel thrombi. So these are all blood effects. The swelling of that placental lining. So they're saying, yep, our case, basically what they're saying here is what we're seeing in our case seems to be being repeated in the literature. These seem to be common findings, or common enough. Maybe it's still like at not a high enough level to be like COVID will do this every single time type of thing, but like it's enough to be like, hey, these are common things that are popping up, common enough that it's concerning. And it seems like about in 1 in 4 cases, there was COVID found in the endothelium. So this is talking about the placenta. So in 1 in 4 cases, they're seeing COVID in the thrombus. So in these blood clots, COVID is sort of centered around it. So COVID is causing these blood clots and in the placenta, and this is happening in about 25% of the cases they see in the literature, which is not insignificant whatsoever. It's kind of alarming. That's a lot. Okay, so now they're talking, they're not directly calling it SARS-CoV-2 placentitis here. They're calling it severe and extensive placentitis, which is a rare complication. So like, let's see, how are they defining it above here? Well, they're not defining what this lower level one is, but they're saying we're seeing a more severe reaction where 75% of the placenta is getting blocked up, which is resulting in fetal asphyxia, so not getting enough oxygen, and stillbirth without fetal infection. So in some severe cases, the placenta is basically just being completely obstructed, almost entirely obstructed by the COVID infection, the blood clots caused by the COVID infection, which is resulting in fetal deaths. But the thing is, like, you're still having severe effects at theoretically a lower level. They're not really defining how gummed up the placenta is here, just that it's gummed up. Doesn't look like it included Omicron and after, so I'm curious because Omicron is more systemic. Yes, so this one is specifically the alpha wave. So this was a while back, right here, looking at the alpha wave, second wave of the pandemic. But I don't suspect that this would have changed whatsoever with the change in variants. I still believe that this is likely occurring at similar frequencies. It's saying here that only the presence of severe or critical COVID symptoms correlates with a higher rate of preterm births. With a pretty okay p-value, so that's pretty strong correlation. So it seems like, or at least what they're getting at, is that like the two things are at play here. One is how severe your symptoms of COVID are, so that's going to be correlated with your viral load if you have a very high viral load. So more virus in your body, a higher frequency of these occurrence of events. So that's one thing that's causing it, and then also the timing. When in this development cycle is it occurring? Those seem to be the two things that are at play, at least at this point, from what I've seen so far. My initial reaction is it might be increased frequency now, but that's purely conjecture. Yeah, that's my my gut is saying that it's likely going to be an increased frequency of occurrence. But this is something that hasn't really been super studied yet. I'm still having to like dig for these papers and these case studies. I think part of it is an awareness issue. Clinicians not necessarily being aware of it. And once they get aware of it, they'll notice it more frequently. It's one of those things like once you see it, you can't stop seeing it, type of thing. Hello. But that's also my initial reaction. And then I gotta take my blood pressure in a few minutes. But it's seeming like there are a few cases of vertical transmission from the mother to the fetus, but it seems like that's pretty infrequent, so that's not necessarily the worry. The placenta seems to do a really good job at preventing the virus from getting to the fetus, but I mean, it can happen in rare cases, but it seems like the bigger issue is this SARS-CoV-2 placentitis and how gummed up the placenta gets. And then ACE2 is present in the placenta. So my theory is that it's not necessarily that the placenta is blocking it, but I'm guessing it has a bunch of ACE2 receptors, and that the COVID is binding to these ACE2 receptors, which is causing blood to sort of locally form, or like blood clots to locally form around this binding. So I imagine that like it's basically like having a bunch of defenders, like a bunch of barriers. So like the COVID goes boop, gets knocked in, another more comes boop, gets knocked in, and then it just like builds up the blood clots. So I'm guessing it's not necessarily that the placenta's like blocking the virus. It's just that like the virus is really attracted to the ACE2 receptors within the placenta is my guess, but that's complete conjecture. That's just a theory that's not backed up by anything. Pregestational infection. Now in OMI, we may see more reinfections in Omicron, adding cumulative damage. Yeah. Well, that's interesting. So the placental expression of ACE2 decreases during pregnancy, suggesting a differential risk of viral infection based on gestational age, mainly depending on a higher activity of the disintegrin and metalloprotease domain 17 or tumor necrosis factor alpha converting enzyme since the early second trimester. So yeah, they're just reiterating essentially what I just said, saying that they think that because of high intermediate rates of placental ACE2 during the early second trimester, that this is likely causing it, that's causing the COVID to get caught in the placenta, causing this, where's the word? Fetal hypoxia, the lack of oxygen to the fetus. Interesting. I always like when the authors come to the same conclusions I do. Yes, that's why I was curious about weeks gestation at infection. Yeah, I think that is like one of the big things is the weeks gestation at infection. Look at that. The article argues that COVID could cross the placenta at any stage of pregnancy, either through blood transmission or through the maternal-fetal interface. However, it seems unlikely that the virus could cause direct neurological damage because ACE2 is not expressed in the brain. It's interesting because I've seen studies that have shown vertical transmission of COVID in the brain in the fetus, so that's I'm going to make that purple because I don't agree with it. Well, I agree with this part. Let me highlight the other part, separate it into two parts. I agree with this part. I'm going to do green because it's interesting, even though it's bad. I don't agree with this part. The article concludes that the findings provide information on the possible vertical transmission pathway of COVID and its potential implications. And they're just saying that this might be something interesting to look at, this HMGB1 protein. I'm not interested in that. I'm more interested in what is happening, and then once I get a better sense of all the things that are happening from COVID, then I would be interested in stuff like that, but at this point in time, I'm not interested in that. Yes, I love it when the authors arrive at the same conclusions as I do. It's so validating. And it also means that the article is written very well, because anyone that's reading an article should come to the same thoughts and the same conclusions that the author did. If you're coming to different conclusions after the author has walked you through the same steps in the thought process, that means that the article is either not written well, or they're making a big leap in the conclusion, or you just didn't understand the article. So those are the three things that could happen. And then the mono die or die, yeah, that's probably a better way that they could have written that for the twins earlier up there. I didn't talk about it, I don't think, but there was we were scrolling through and reading through, and there was a study in here about twins where one died. And then the conclusion. So that's basically the whole thing of this paper, is that the direct infection of the placenta caused an indirect COVID-related death of the fetus, or a COVID-related impact that resulted in death of the fetus. It resulted in an abortion of the fetus because of brain damage and severe impacts of the COVID infection itself on the mother, because the mother went through a lot of shit in this. She really had it tough. And then they're saying that we need to focus on this. This is something that we need to pay more attention to. Cool. Control S, save. And that's that paper. So then we'll do a quick summary of everything we've learned after I do a quick stretch and read some comments. It's the best way to yawn. Try screaming next time you yawn. I do it all the time. I started doing it when I was a kid. Yep, I completely agree, Christina. And then, all right, so this paper was a case study. It was looking at a woman that is 36 years old, has a history of 2 failed pregnancies, has hypothyroidism that the person is on medication for. They contracted COVID in the 15th week of gestation. They went into a medically induced coma for a little bit. They had to have a trach, and also they had a feeding tube placed in to maintain nutrition to the patient as well as to the child. Dang it, I just yawned too. That means you have empathy. 1 second. I'll come back. My partner is yelling. What up? Alright, I'm back. Oops, tripped over my Allen wrenches. Dang it, I yawned too loud. So my partner was just asking about, she told me to get her some apples. So, short story is that my first job was on an apple farm, so I know a lot about apples. And, she told me to pick her out a good apple, and she likes sweet, and tart apples. So I got her Pink Lady apples because that's basically a combination of a crisp, sweet, tart apple. Anywho, she just wanted to know what apple I picked her out last week so she could buy it again. So yeah, leave it where we left off. So I think we're at the complications. So the mother had a lot of issues, got infected at 15 weeks, was in the coma, had a feeding tube and a trach. So she had a very, very severe COVID reaction or a COVID infection. So that means that the mother has a lot of COVID virus virions in her body. And then the decision was made after the mother woke up from the coma that they were going to abort the fetus because the fetus had brain damage, significant brain damage. So with the major complications on the mother, she made the tough decision of aborting the fetus in this second trimester. I'm sure it was a very hard decision. And the fetus was sent off for necropsy. They also took the placental tissue, even though they didn't mention it here. That's also something they grabbed and looked at. So they scooped all that out, sent it over to pathology. And they found out that the fetus did not have a COVID infection. It didn't have vertical transmission, so the mother did not pass the COVID infection onto the fetus. But the placenta, what it had was a lot of fibrin deposits, so a lot of blood clots that accumulated and built up and gummed up the placenta. The fetus didn't have, it was developing normally, so it wasn't some sort of genetic issue, it wasn't a developmental issue, it was a direct issue to the COVID. There was brain hemorrhaging, so there's bleeding in the brain. There was evidence that there was ischemic damage, which means that a lack of oxygenation, the cells died in the brain, the adrenal glands, and in the heart, so there was pretty substantial damage. This child, if they tried to keep it till birth, would not have survived most likely anyways, so it would have been a stillbirth, is what I'm guessing based off of these findings. There was a lot of, there were hot spots, you never want to see that word, hot spots of necrotic deciduitis, but this was in the placenta, so the placenta was completely, had huge areas of cell death all throughout. Autoantibodies, though. Yes, they tested for antibodies in the blood and in the heart, lungs, bowel, and then they did peripheral blood sampling of the fetus, and it was negative for all the antibodies, so no, it didn't have the antibodies. Good question. And they tested for other viruses in the blood and urine of the fetus. It was negative for any other viruses. And yeah, that's pretty much it, is that the COVID gummed up the placenta, prevented it from being able to exchange nutrients and properly nourish the fetus. The fetus went through essentially decay, didn't get enough nutrients, so it started dying off. The issues are severe enough that the fetus likely wouldn't have survived birth. They had to do a late-term abortion, and this was all as a result of the mother having a very severe COVID infection. So that's what the study showed us. Oh yeah, no worries. These articles are a lot, and yeah, that was one of the neat things they did. This is a very, very good case study. Yeah, and that mother went through hell. My lord, let's just appreciate, because you gotta remember that for these case studies, not only is it the doctor writing it off, but this is an experience that a person went through. So like they came into contact with the person, they got deep vein thrombosis, so they had these huge blood clots in their legs that had to be cleared. They had to be, we missed the tracheotomy. And then her symptoms, the pregnancy during her symptoms were fever, chills, lower limb weakness, and thoracic oppression. She stopped being able to breathe. So they did a tracheotomy. And then, where's the other part? Here, I'm gonna control, because I know it was 19 weeks. And then the patient underwent intubation, went through a medically induced coma, woke up 4 days later, and then had to make the decision to abort their third. So like they had 2 failed pregnancies, and this was the third pregnancy, and then they had to abort this one because of the COVID infection. And it seems like this pregnancy was going completely fine prior to the infection. So this mother truly went through a lot. Oh, and the stomach, the feeding port. So she had a feeding tube placed. She had the tracheotomy that she likely will still have to live with. Blood clotting, loss of child, third child. Probably won't do this again because the patient's older, 36 years old. So yeah, that's a lot. That is a lot. But yeah, sorry, I feel like I left on a depressing note, but that's this paper. I'm gonna save this, transfer it over. I'll show you a glimpse of the next paper, but I'm gonna take a little break. We're gonna drop that into the red file. And then the next paper that I'm gonna look at is another one on, this one's called Newborn Early Infant Outcomes Following Maternal COVID Vaccination During Pregnancy. So this is a good one. This is going to be a one that's talking about vaccine protection in pregnancy. So this is likely going to be a very good article, so that'll be positive. Tracheotomy heals after it's taken out. It takes about 3 months to fully heal. Okay, I wasn't sure. I haven't read too much on tracheotomies, so that's good to know. That they do heal up. Well, yeah. Good. Well, that's some good news. So we learned a lot. Thank you, everybody. I'm going to log out for now, but I'll log back in later to read that immunization paper. Bye.